Hello everyone, this is Dr. Ezi, and today we are going to discuss another anatomy station for the MRCS part B, and it is related to the pancreas. Okay, so this is the pancreas here. They are going to show it to you somewhere according to your center. Okay, they are going to ask you about the parts of the pancreas. This station contains 6 to 7 questions according to the situation. Okay, so you want to know that this is the head and this is the neck, where the pancreas turns to the left here. This is the neck, okay, and this is the body, and this is the tail, okay, and the tail is connected to the spleen by the lean-urinary ligament. So you just need to know these two parts, because there is some sort of demarcation here, but there is no demarcation between the body and the tail, as you know. Okay, so as a beginning, this is the start of the station of the pancreas in your MRCS Part B exam. Well, so the first question is going to be about the parts, and it is done already in the administration. And they are going to go to the second question, and it's about the eyelid cells, okay? Eyelid cells. And in this case, they are going to ask you about two things. The first thing, or actually the question is about two things. They may not ask you the questions, but if you do not answer for the two things, you are not going to get the full answer. So the first thing is that, what are they? So the types of the eyelid cells, and they are going to expect you to answer about the function of each type of eyelid cells. So for the types, actually, you know that they are alpha, beta, and delta, right? Okay, so about the function, you know that the alpha produces glucagon. Are you with me? Well, and the beta produce insulin, and the delta is going to produce somatostatin. Okay, so these are the eyelid cells. Nobody is going to ask you about the function of the hormones. So now they are going to move to the third question in this station. The third question, as I mentioned before, is going to be about the blood supply, and this is a beautiful question actually, because the blood supply of this pancreas is so clear and straightforward. It has 3 origins. Okay, you want to know them. And this is the superior pancreatico-duodenal artery, and the inferior pancreatico-duodenal artery, and pancreatic branches from the splenic artery. So these are the main sources of blood supply of the pancreas, but this is not a full answer. So you want to mention that the blood supply of the pancreas is coming from the number 1 superior pancreatico-duodenal artery, which is coming from the gastroduodenal artery. Okay, and you want to mention that the second source of blood supply of the pancreas is the inferior pancreatico-duodenal artery, which is coming from the superior mesenteric artery, and actually these branches are coming from the splenic artery. This way you are going to get the full mark for this question. Okay, so let's go to the next question, and the fourth question is about the ducts, the pancreatic ducts. What do you know about the ducts? And also there is a direct answer and there is an indirect answer. You want to know both so you can get the full mark of this question. So actually there are 2 ducts, as you know. This is easy. There is a main pancreatic duct and there is an accessory pancreatic duct. Are you with me? Okay, but you want to mention that the main pancreatic duct actually drains through the major duodenal papilla, right? And you want to mention also that the accessory one drains through the minor duodenal papilla. In this way, this is the full answer. Okay, regarding question 5, or the next question, we mentioned it in the illustration already, that what connects the tail of the pancreas to the spleen, right? And we mentioned before that this is the renal ligament. Renal ligament. It's a very simple question, and actually nothing hidden here. This is the answer. Okay, so the next question actually could be your last question, or it could not. Okay, so it's about something nobody likes. It's about embryology or the development of the pancreas. Okay, so you want to know the embryology of the pancreas, and it is very simple. Well, and as usual, there is a direct answer here, and there is some hidden thing that you want to mention also. Okay, so number one, you want to mention that it develops from the ventral bud, yeah, and you want to mention that it develops also from the dorsal bud. If you answer like this, this is good information, that is the right information, but it is not the full answer. So you want to mention that ventral bud actually originates from the what's called the hepatic diverticulum. Okay, and there is another hidden agenda here, that this ventral bud actually forms number one, it forms the upper part of the head of the pancreas, and it forms the uncinate process. Okay, so this part here has three points that you want to mention. You want to mention that the ventral bud comes from the hepatic diverticulum actually, and it produces the upper part of the head of the pancreas and the uncinate process. The second part of this answer here, which is the dorsal bud actually originates at the dorsal aspect of the duodenum, so there is no problem about it. Originates from the dorsum of the duodenum. Okay, this is easy actually, and it forms or produces all the other parts of the pancreas. Anything other than those two is formed by the dorsal bud. So upper part of the head is here formed, so the lower part is in lower part of the head. Number two, the neck. Number three, the body. Number four is the tail. Okay, so this is the embryology of the pancreas in very simple words. Okay, so finally now let us go to the seventh question, and actually I'm afraid that if they ask you this question in between and your memory hesitates, you may lose this station. So you want to focus on this question. If it is the last one and you miss it, it's okay, you are already relaxed. The previous ones are easy, and you are going to get maybe 75% of the marks. Okay, this question actually is about what's called Whipple's procedure. Okay, and they are going to ask you what are the vessels involved in this procedure. Okay, and I made it 7 here because they are 7. Okay, there are 7 structures that involved in Whipple's procedure. So we are going now to mention them. Number one, it is the abdominal aorta. Okay, number two, we are going to mention the superior mesenteric artery. Okay, number three, we are going to mention the superior, okay, sorry, I'm going to make it in red, superior mesenteric vein. It's easy, right? So till here, abdominal aorta is easy. Superior mesenteric artery and vein are connected together. Okay, we are going to mention the arteries that supply the pancreas itself, and here actually there are 2, right? There are 3, but 2 of them are involved here. 4 and 5. As you remember, these are the superior pancreaticoduodenal artery and the inferior pancreaticoduodenal artery. Are you with me? Okay. So now there are two other foreign structures that you want to remember, 6 and 7. And the sixth one is the left renal vein. Okay. And the seventh one is, as I remember, it's the splenic vein. Yeah. Okay. Fine. So you want to find a way to remember these, but you want to know that abdominal aorta, superior mesenteric artery, superior mesenteric vein, superior pancreatic duodenal artery, inferior pancreatic duodenal artery, left renal vein, and splenic vein are involved in the procedure. And in this way, you are going to finish this station in a very successful way. So let us meet on the next station. Thank you so much.